Hello, so this is my review of the medical app. The app that I chose is called Medscape, which is the one right here. If you click on it, it opens up the app. This is the homepage. Here on the homepage up top, you can see the most popular articles, such as let first year residents work longer shifts, some sort of a program proposes. Then here it gives you the categories of the different drugs. You can look up the conditions, procedures, drug interaction checker, and pill identifier, which I'm going to go into in a little bit. And then here, if you click up here, if I can click it, it just gives you a little bit of more of a breakdown. You can choose news and perspective, just gives you different articles that you can find. Education is where you can teach patients and relatives. Specialties, the Medscape is tailored to any medical professionals such as nursing students, doctors, respiratory therapists. I just chose nurses because that's the area that I'm familiar with. And then here it just says different invitations that you can subscribe to and just your username, saved articles, updates, help, and notifications. The standard stuff. Okay, so I'm going to go back to this part. Here is the drugs. Sorry if I go off key. Okay, the drugs here. It gives you the list of any drug you can think of in alphabetical order. So the drug that we're gonna go look up is acetaminophen, which is Tylenol, which is helpful for headaches and not so good for your liver. So there it tells you the brand name is Tylenol. It's an analgesic. So this breaks it down to dosages and indications, different interactions with other drugs or foods, adverse effects that really should be watched out for, warnings, probably something against your liver, pregnancy, don't take Tylenol when you're pregnant, pharmacology, just gives you the chemical breakdown of it, images, because, not every pill is a little white pill, and formulary. So if you go to dosages and indications, it comes in 325 milligram or 500 milligram tablets. Comes in caplets, capsules, gel caps, tablets, oral solutions, and all of those different ways. And you have interactions. These are the drugs that it interacts with. Don't take it with Coumadin because then you'll bleed to death. And don't take it with alcohol because then you won't have a liver. Adverse effects. It can cause dizziness or rash. Laryngeal edema where you won't really be able to talk. Then liver failure if you take too much of it, which is why people use it. Warnings. It can cause hypersensitivity, severe liver disease. So that's just the different warnings that people can look up for different drugs. I just chose Tylenol. For pregnancy, it crosses the placenta, so it's safe to use in all stages of pregnancy short term. It's compatible with breastfeeding. Surprise. And then pharmacology. These are just whatever the pharmacists need to know. Images. What they can look like. Different packaging that it comes in. And there's no formulary available for this drug. Okay, so that's the breakdown of the drugs category. And then here we have conditions, which lists every condition that a human body can have. So we're going to go into gastroenterology. And then you can go into the pancreas. And then these gives you all the different conditions that a pancreas can have. Acute pancreatitis, chronic pancreatitis, pancreatic trauma. And then this breaks it down into what it really means, the signs and symptoms that you can have, physical findings, what the diagnosis is, the management, how you can treat it, and then there's the different references that were used to come to these conclusions. Oh my god. Okay. So this can be done on any different type of disease and condition that a human can have. Different types of procedures that can be done. Go again to gastrointestinal. Now we'll go to bariatric surgery, since this is such a popular surgery to have these days. So this is done to prevent obesity, where they cut out most of your stomach and then you have to eat liquids for the rest of your life. So here it gives you the background, what it really is, and what type of surgery it is. And of course, they have to give you statistics. And this is also for any other, like a colonoscopy. The same type of concept. And then here, drug interaction checker, where you add 2 different drugs and see if they're compatible. Pill identifier, where you can differentiate between shape, color, form, and scoring. And then if you have multiple pills in the same box without an identifying pill label, then this is where you can try to identify what the pill is before you throw it out. And you don't want to take the wrong pill, obviously. Formulary, this is just for pharmacists to use. And calculators, where you can calculate different types of scores that are needed in order to be able to use a medication. Or any sort of bleeding risk, for example, see if you're what you need to be on Coumadin therapy. Or the APGAR score, when the baby is first born. So this is a really cool app that really breaks down a lot of the conditions that the humans can have and ways to look it up by drugs or conditions or procedures. And then you can always identify the pill depending on its color. And I think this is a great app to use, not just for nursing students, but for nurses that are brand new starting out or seasoned nurses that just need to brush up on their skills a little bit. And then, of course, it's also targeted for any other healthcare professional.